We just had our third death this morning. This protective gear that you see has to be worn for the entire day. We only get one for the entire day.
As the novel coronavirus plows its destructive path, doctors and nurses leading the battle, but often feeling unarmed.
I have nurses that call me on a daily basis to tell me that they're scared, to tell me they don't know what to do. We didn't sign up to cause harm. At this point, we know that we're the ones that are going to take it into the community without the proper PPE.
Tonight, their voices, a chorus of concern that the very people on the front lines are in danger.
How many of my coworkers have to become severely ill and risk dying before the government really takes notice and gets us the proper PPE we need?
The growing toll, both physical and emotional, rising among their ranks. A well-known neurosurgeon, an ICU nurse in Miami, among the casualties.
All the patients in this room, all the feet that you see, they all have COVID. And this is only one of the several rooms.
Some say for COVID-19 in the U.S., this is ground zero.
The situation right now is overwhelming.
Elmhurst Hospital in Queens, New York, seeing as many as a dozen deaths in a 24-hour period from the virus. Primary care physicians like Dr. Luz Ares are working to ease the crush of patients on hospitals like Elmhurst.
We have a big role because if we take care of the patients that are not too ill, then the ER doctors will have more time to take care of the sickest one.
Ares and her husband, Dr. Carlos Gonzalez, met in medical school in Puerto Rico. They've served this Queens immigrant community for decades in their private practice.
How dangerous is this virus for healthcare workers?
It's terribly dangerous. I had a staff meeting with my 3 medical assistants, and it broke my heart. I tried to have a contingency plan of I rescheduled seniors. I checked the temperature on the entrance of the office. I saw 2 patients that were ill, and I felt I had no defense. And I said, this is not working. I don't have the gear to protect my staff or myself.
What started as a steady stream of cases in early March became a wave of sick patients cresting over this dense working-class corner of Queens.
Many of them depend on public transportation, and I think it's my theory that because they use the subway and the buses, you could never find an empty sidewalk. It's very crowded. And this virus is so contagious.
And in this case, you feel defenseless in many ways.
It's like fighting a monster with a water gun.
Dr. Ares believes that her husband's job, which included checking patients for strep throat, put him at risk and may have exposed him to the virus.
And as a former ER doctor, what made your husband finally say, I'm going to the ER?
He told me, I don't feel right. I'm not breathing right.
It's been 10 days since Dr. Gonzalez tested positive for COVID-19. His wife had to leave him at the door of a Long Island hospital on the eve of what would have been a doubly special day, the couple's 38th anniversary and Dr. Gonzalez's 66th birthday.
How are you doing, both physically and emotionally?
I think physically I'm fine. I think emotionally I'm trying to be strong.
And yet you've joined the ranks of the patient population, unable to visit your loved one in the hospital.
That was so hard. I think that was the hardest thing. We've been together for so many years. Oh, I'm so sorry.
Hi, how you doing?
With word of her husband's now stable condition, Dr. Ares is focusing on her patients.
Dry cough,
Teleconferencing day and night.
sore throat.
What's astonishing to me is your husband's in the hospital fighting for his life, and you're seeing 100 patients a day.
It's really a calling. You have to be selfless. In Puerto Rico, we have a saying that once you sign up to be a soldier, you have to march.
For us as registered nurses, we are compelled to help and to heal.
Bonnie Castillo is the executive director of National Nurses United. She says the lack of personal protective equipment is forcing medical professionals to make choices they should never have to make.
Decisions as to whether they can work in conditions where they themselves could become vectors in the spread of this virus and actually cause harm instead of healing.
Hey, Mike.
Hi, how are you?
Michael Korodakis has been an ICU nurse for 25 years. But these past few weeks, he says, have left emotional scars.
I used to joke that you can only get PTSD if you have feelings. Even the most hardened practitioner, everybody cries at work. It's just, it's part of it now.
What triggers the tears?
People die alone now, and that's unusual. I had a 35-year-old patient die, on me the other day with nothing significant as a medical history. This is a horrible, horrible disease.
And so tell me about that patient.
He was my only patient for the first part of the 12-hour shift because he'd coded a couple of times during the day.
Coded meaning his heart had stopped.
Right. The phone rang, and it was his wife, and she said, "Can we FaceTime with him?" And I said, "Absolutely." So I straightened up the room. I made sure that he looked nice for the call. When the monitor started alarming, I looked up, and his heart rate was dropping, and his blood pressure was dropping, and within just a minute or two, he was almost gone. So I just stopped what I was doing, and I went with him, and I talked to him. I said that his wife was thinking about him, that I just spoken to her. And that his family loved him and missed him. And just tried to say the things that I thought I might want to hear if it was me. I just called her and let her know that he had passed away. And she still wanted to FaceTime with him. And then she handed the phone around and gave it to their son, a 10 or 12-year-old boy. And that was hard. He just said, "Poppy, Poppy, please don't leave me alone in this world." That was it. Hung up the phone and then did what I do. Got him ready, and then I got 2 more patients from the ER. So the beds don't stay empty for very long with this.
It feels like combat.
I guess walking into combat, at least you know where the firing is coming from, and you can shoot back. We walk into this without any weapons,
And you don't know where the enemy is.
Yeah. Luckily in this hospital, we still have pretty good PPE, the personal protective equipment. So I have not once gone without an N95. But there are hospitals around the country that have run out. But the truth is, once your doctors and nurses die, you don't stand a chance. If we die, you die. And that is the truth.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.